Thank you very much for the wonderful keynote speech, Professor Dabarati. In the upcoming section, we are going to hear a student presentation from one of our current Master of Global Health student. But before we would get into it, I would like to introduce you to our online Q&A platform. So following this link, you can access the platform where you can register and save your questions even during the presentation. You will also have the chance to upvote the questions that you find to be the most interesting. Unfortunately, because of the strict time frame of this seminar, we won't have the time to answer all your questions. But after the seminar, you can reach out to our speakers and ask your questions online. Yes. So, at this point, I would like to introduce you our student speaker, Fiorella Farge de la Torre. And trained in Peru and Amsterdam, she has a background in sociology, and now she's pursuing her studies at the Masters of Global Health. Her main research areas are indigenous health, sexual and reproductive health, and interculturality in healthcare. Please welcome her presentation.
Thank you, Sita, for the introduction. And dear all, I'm really happy, as my previous speakers also said, to be finally in a live event after so many months in front of the screen. And first, I would like to thank the organizing committee for making this event possible, and also for the invitation and the opportunity that they have given me to address you today. I'm going to talk today about the sexual and the reproductive health in times of COVID-19. I will like to start with some background. When the WHO declared the COVID-19 global pandemic, there was a rapid reaction from different academic institutions and advocating organizations that were talking about the potential impact that the pandemic was going to have in the sexual and the reproductive health and rights. There was a report from the European Parliamentary Forum for Sexual and Reproductive Rights and the IPPF, where they were already showing that some of essential services were going to be disrupted, and some of these services were contraceptive, abortion, reproductive cancer screening, maternal health, among others. And even when the services were in place, they experienced, this was example of some family planning centers here in Brussels and in Wallonia, that they also experienced at least 80% reductions in visits. So based on this experience, sorry, it's the other way around. Yeah. So based on this experience, we can, in the early evidence, but also in past outbreaks, like for example, the Ebola in 2018, we can expect that the health services were going to be disrupted, both for the demand side and also for the supply side. The demand side, due to fear and mistrust in seeking health, financial difficulties, and also travel restrictions. And from the supply side, due to insufficient staff, cancellation of elective services, and also change in treatment policies. But why should we be concerned about this? And this is some of the findings of a report from the Guttmacher Institute, where they estimate what was going to be the impact on the sexual reproductive health by the 10% reduction of some services. And some of the findings are that a 10% decline in use of contraceptive could result in more than 50 million additional women without an unmet unmet need for modern contraceptive. And this could also result in more than 15 million additional unintended pregnancy. 10% reduction in the service coverage for essential pregnancy-related services could also cause almost 2 million additional women experiences major obstetric complications without care. And this could also lead to 28,000 additional maternal deaths. And finally, a shift between abortion to safe to unsafe abortion. This could also lead to more than 3 million unsafe abortions. So unfortunately, what the early evidence show is that indeed there was a disruption of services. And this is the result of the second round of national pulse surveys on the continuity of essential services made by the WHO, where they indeed show that for the 93 services that were part of the survey, 94% of the countries reported that at least one essential service was disrupted. And we can see that family planning and contraceptive is the one that was most disrupted. So it's in this context that a group of researchers from the Academic Network in Reproductive Health and Policies and a team from the London School of Hygiene and Tropical Medicine come together and decided to further investigate what was going to be the impact on the different measures and in general the pandemic on the sexual and reproductive health. And the survey and all the data was collected in 30 countries, mainly through an online survey, most of them with a convenient sample. And some of the topics that were addressed in this survey was sexual behavior, access to different sexual and reproductive health services like contraceptive, abortion, among others. And but they also cover some topics as sexual and gender-based violence and mental health. The result for the first round was more than 23,000 respondents, of which 67 were women, and with the mean age of 34 years old. I will go through some of the general findings and then some snapshot of the result of a few countries, so you can get an idea of what was the result of this first result of the survey. So I will start with the overall findings. And one of the first things that we saw is that the satisfaction in sex life decreased. It passed from 76% pre-COVID to 59% since the COVID started. There was also a decrease in condom use, and it was 14% for those with a casual partner and 10% for those with an steady partner. We also saw that 9% reported more difficulties to access to condom during the COVID, and that 9% reported partner violence pre-COVID to compared to 7% that reported during COVID. And this was quite a surprising finding. To continue with the general findings, three more important ideas that I wanted to share with you is that 70.5% of the respondents seeking for contraceptive reported that COVID stopped or hindered the access to contraceptive. Nearly a third of women needed an abortion, reported difficulties to access to these services. And finally, that almost 40% of those in need of an HIV and STI testing reported difficulties to access to this service. To start going through a world tour, I would like to start with some result of Latvia, where they reported that 34% of the pregnant women didn't receive information on how COVID could affect their pregnancy. If we go to Latin America, we can see that in Panama, 45% of the respondents reported that condoms were more difficult to find during the COVID. Also, that more than half of those who needed an STI and HIV test were unable to obtain one. And also that near half of the respondents living with HIV reported that they interrupt the HIV care. And this was quite a striking figure. If we continue, we can see that in Moldova, on pregnancy decision during the COVID, 1 in 6 respondents, they decided to postpone the pregnancy. And this is also a result that we saw in many African countries. To continue with Singapore, we saw that there was a notable decrease in sexual satisfaction, especially for respondents who were single and not living with a partner. And finally, in Kenya, there was 93% of the respondents that say that they believe that girls were at an increased risk to early marriage because of COVID, and 73% said that the girls were at an increased risk of female genital mutilation because of COVID. So this has been some snapshot of the result, and the analysis of the data is still ongoing. And now there is even a second round of data collection. And this is called the iShare 2, where many other countries have also joined in. I would like to share with you just some reflections of the project and also my participation in the project. And to start, for me, one of the most interesting things of a project of this magnitude and with such a rich data is the opportunity to propose new research. And this is the case, for instance, of a study on mental health among young people that was proposed for by Lore Remery and Kristen Michelsen, and I think both are here now in the audience. Also the case of the latest study that I have been involved with is about the implementation and the challenges in research recruitment that was proposed by the young researcher Hannah Saltis from Australia. Like these proposals, there are many others, and I think this wouldn't be possible if we shouldn't come together and make the discussion a creative process. Likewise, I would like to highlight for me the importance of the network that has been built up from this project. And I think this wouldn't be possible if dozens of researchers, but also institutions have not joined voluntarily. And on one hand, I think that this network could bring together people from different disciplines with different skills, and this could make all our discussions like a very productive and learning process, at least for me. We have teams for many different disciplines. So sometimes there are statisticians, epidemiologists, people from the social science, but also experts in sexual health and adolescent health. And now all these teams are working together to analyze and write report of this very rich data. But also this network bring together people with skills in programming a survey, for instance, and this was a huge challenging work, especially because this survey was translated in more than 20 languages. And finally, for me, this network also bring together teams from national teams from many parts of the world. You just saw like some of the countries, but there is more than 30 countries. And these teams are going to help us to better interpret the national data. But this network also bring the support for some researchers that really need it. And I just a few days ago read an interview that the Answer Network did to Gunta Lasdane. She's professor of reproductive health and head of the iShare team in Latvia. And she mentioned that without the support of the iShare network, she wouldn't be brave enough to apply for a funding of a research program in Latvia. And for me, this is an invaluable support. And I would like just to finish this short presentation by encouraging all my colleagues and also all those present to keep working together, because for me, based on this experience, there is not a better project than the one that is done in collaboration with the transdisciplinary work. And I think we as students and professionals working in global health, we must promote articulation and collaboration with, again, people with different disciplines, but also different backgrounds. I think this is the only way that we could achieve a change. Thank you very much.
Thank you very much, Fiorella, and thank you all for listening. I would remind you, if you have any question, to please go on the website on the bottom right of the page. You can find 3 dots, and if you follow there, you can access the Q&A platform if you haven't done so already. I will start off with some questions that we already received. So we have someone asking you, Fiorella, if there is a certain discipline or disciplinary perspective that you thought was missing or in the research you presented, and also if in what way could other perspectives build further on this work?
To be honest, I think there is pretty much diversity on the people who is working now. It's really difficult to say that from all the national teams, but also the people who is working now in the analysis are missing. The project not only have, because apart from disciplines, I think the perspective also depend on the person who is joining. So we have from students to PhD, to postdoc, to professor. So the variety of the people who is part of this project is very diverse. I cannot think on a discipline that is missing, but yeah,
Thank you.
A pretty great group.
Thank you very much. Building to further on what Professor Guhasepir mentioned before, I wanted to ask you, is there any discipline that you found especially hard to communicate with during the project? Or maybe the program helped you building this bridge in communication?
I don't know. I think it was not hard. I think I also was in a position where I was learning a lot. I was just taking all the knowledge of all these people and experts that were working in this very diverse group. Maybe those who have some more skills in programming and more like statistics, that I have some knowledge, but I'm not an expert. So it was sometimes a little bit hard to understand. But I think the positive thing of this network is that you can always email this person and then just ask further questions. Really, it's a really open group, and Yeah, just to put an example, like few days, well, a couple of weeks ago, they were also presenting a very nice graphs and visuals about the data. And it's like, I also want to learn that. It's not only about just letters, but also how you project and how you visualize the data for those who are not experts. And it's easier to just take the main message that you want to send. So I just send an email. It's like, oh, your graph and your visual was great. Can you tell me like which program? And I'm pretty sure there was a pretty busy person, but she replied to me, and then yeah. So these kind of things I really appreciate of this group. So I don't understand something, I just ask.
Thank you. Over to you, Zita, for the next question.
Another question from the audience is whether you can think of a reason why domestic violence decreased during the COVID pandemic.
This was a surprising finding, as I said in the presentation. And I think the most intelligent thing to do with this is to see the national data and to see in which countries actually it decreased and in which country it went up. Because for literature that we have revised, actually there is an increase of partner and sexual violence. But yeah, I think it's just about looking better to the data and then talk with the national teams to further explore what was actually happening in that country and what could be some of the reasons about it.
Thank you. Thank you very much. We will now take a last question, but everyone who had a question that was not addressed, and Zita mentioned before, please feel free to reach out to Fiorella during the break, or there are also our email addresses on the website. So there's an anonymous here saying, nice presentation, and thank you for sharing. I would like to know what were some challenges you encountered working in a global network in a transdisciplinary way. So far you've mentioned all the good parts. Any challenge for you?
I think it's challenging, but I think I started from a point where I said I'm not an expert in everything. So there are many things that I couldn't understand that were maybe a little bit confusing for me. And I think the challenge might be just to take the courage and to approach all these persons that sometimes I don't know, with professor, we just told them like, yeah, they will not have time to just answer my dumb question about just a figure that I couldn't understand. But actually, it's important. And if you are interested in this project and you also want to contribute, that is at least my case, I think it's just important to break all these all these thoughts that just retain you to send an email, reach someone. I think networking is a really important skill. It's not an easy skill. I know I can say it, but it's important. And I think if we are in an environment where we want to collaborate, where we are open, where we have an open mind, I think this is possible. So yeah. I will finish there.
Thank you very much, Fiorella.